Welcome, everybody, to STEAM Awareness Week. We are doing a talk called Can Steaming Reduce Hysterectomy Rates? One of the things that inspired this was that I was learning about how high hysterectomy rates are. They're really high. And I believe that the hysterectomy is the second most performed surgery in the world after cesareans. And let's see, hysterectomy rates per day. I think it is, I'll pull it up for you guys in a moment, talking about the number of hysterectomies per day or per year, but it's really high. It's the most performed, one of the most performed surgeries in the world. And in the work that I do as a STEAM therapist, specifically a parasteam hydrotherapist, when I work with people one-on-one, often I work with people whose doctors have recommended hysterectomies. Now, sometimes those people use steaming very actively and are able to make a choice not to do the hysterectomy, or it delays the time period and gives them more time before they would decide to do the hysterectomy. But my point is, I've seen so many people cancel hysterectomies, just not need them after doing steaming, that it made me wonder if we should be a little bit more active about talking about the potential of canceling hysterectomies by using steaming and by using steaming actively to do that. I do think that the hysterectomy rate, hysterectomies, although they save lives, I think that it might be higher than it needs to be. I think there might be some unnecessary hysterectomies that are being performed. And then also when you just look at the history of hysterectomies, and when you look at modern gynecology, the uterus isn't considered necessary outside of reproduction. And so for that reason, hysterectomy will often be performed as, oh, okay, if you're finished having kids, might as well just take it out, and then you have nothing to worry about, right? So in that way, hysterectomy might be recommended more frequently than it should be if we find that the uterus has functions outside of reproduction. And I think that using anatomy itself, we can find that there are functions. The uterus makes hormones and communicates triggers to the brain for our hormone release in the ovaries. And so a lot of times there will be like a partial hysterectomy recommended at first in order not to disrupt the hormones and the hormone production of the uterus. But really, we don't know what impact doing a partial hysterectomy has on hormone production, since some of the hormones line the inner uterine cavity. And then we also don't really have a full understanding of what impact it has to do a full hysterectomy as well on the overall hormones. So anyways, thoughts about hysterectomies. I got lots of them. Today, I have my dear friend, Liz Ramirez, who has joined us. Liz, I've known for, I think, about a year now. And she is somebody who was dealing with health challenges, and her doctor was recommending a hysterectomy to her. It has been a couple years since that time, and she still hasn't had the hysterectomy. And I would like to hear more about this story. Liz, can you tell folks what was going on with you?
Yes. So in 2020, I was diagnosed it was in July of 2020, I was diagnosed with uterine fibroids. And I got imaging, to find out how large they were and how many I had. And the gynecologist recommended a hysterectomy. And that was the only treatment option I was given. I was like, okay, well, do you recommend anything else? Is there anything else I could do? And she's like, no, your fibroids are large. And so you just need to have a hysterectomy. I mean, honestly, I didn't ask many questions. I was totally shocked. And, just emotional and everything. And so they went ahead and scheduled a consultation with me with a surgeon. And so I decided, you know, it's covered by my insurance, so I may as well just go and I can ask a lot of questions. At this time, I had already found steaming. I found steaming in late 2019 when I was having reoccurring UTIs, which at the time I didn't realize were connected with my the discovery that I had fibroids. So the fibroids were pushing on my bladder and creating a pocket that was causing the recurring UTIs. And so I had already found steaming and was using it to address my UTIs, and it had stopped them from coming. So I was like, oh, okay, well, I want to keep steaming, and I want to see if there's like maybe a protocol I could get on. But I went to the consultation to talk to the surgeon first, and I had a list of about 50 questions. But one of the main questions I wanted to know was, I know, a lot of questions, but and the consultation was only supposed to be about 15 or 20 minutes. And I'm like, crazy. But anyways, the main question I wanted to ask was, if I got this hysterectomy, if I removed my uterus, will I no longer have fibroids? Like, will the fibroids stop growing? Turns out, no. Fibroids could still grow on whatever was left of my reproductive organs, because they said, you know, they would leave my ovaries, and, you know, there would be other parts of it left. And I was like, okay, well, if it's not going to stop the problem, then again, this is symptom management. You're cutting out my uterus to get rid of the fibroids that are in my uterus, but it's not stopping the forming of them. So there's an underlying condition that we're missing, and that is what I want to address. I want to find out why my body is making these fibroids in the first place. So that was disappointing to say the least. But I started looking for other options, and so I started steaming daily. At this time, when I first was diagnosed, the fibroids were growing really rapidly. We had just got into lockdown, and we were all in our houses, you know, during that time. And so I wasn't making appointments to see doctors at the time, because I was trying to figure out, like, well, what's going on? And, you know, just like everybody was, I guess. But during that month when we were at the house, they started growing really fast. And, you know, I looked like I was about 5 months pregnant very quickly. And so I was concerned, obviously, with this rapid growth. And I started seeing a holistic doctor, and he did a whole panel. And then he was the one who, well, first I started steaming. Okay, I'm getting ahead of myself. First, I started steaming because I was in so much pain. Like the fibroids were very heavy, and just cooking dinner at the end of the day made me feel like all my organs were going to fall out. Like I had to go lay down. I was very anemic because the fibroids were pulling from my body to form themselves. And so I would get my kids off to school, barely like have the energy to do that, starting trying to clean up, and then have to go lay down. And I was so tired all the time, like super fatigued. I would set a timer to, you know, I'm like, I'm just going to take a little nap, but I would set a timer to make sure I didn't miss getting up to go pick up my kids. I'm sleeping all morning, go pick up my kids, bring them back home, make dinner, and just making dinner, you know, like I just was in so much pain. And but this, when I steamed, the steam would just completely take away the pain. So having the steaming was treating the symptoms. The symptoms also were like uterine, like just pelvic pain in my uterus. I had really heavy periods also, and just so much like discomfort. So the steaming was dealing with the symptoms when I started steaming regularly. So I started steaming daily. Like whenever I was in pain, I would just steam. And it was managing the pain to the point that I was like, okay, I don't need to get surgery. When I was in all that pain, I was actually still considering the surgery, even though I knew it wasn't going to solve my problem, but I was just in so much pain. So when I started using steaming, then I was able to use that to treat the symptoms. And that was able to buy me time so I could look into these other options. So I could function so I could do my work, you know, so I could get up and do what I needed to do. So, so I found a holistic doctor, and he said, he did a panel and found out that I have a genetic condition called the MTHFR, which means my body doesn't detox like most people's does. And as a result, I think that's the underlying reason that my body is forming fibroids, because, you know, if your body can't detox, I'm a person that never used to sweat. I sweat now, which I'm
Oh,
very excited about.
yes.
I'm always like, oh, I stink. This is amazing. Everybody's like, you're so weird. Why is that?
They don't know. They don't know why.
And I always used to think, oh, well, I'm just lucky. I'm not a sweaty person, you know, but turns out like my detox pathways weren't working, right? And so I wasn't just steaming. I was doing other things. I did abdominal massage. I did breast massage. I did dry skin brushing to activate my lymphatic system. I did dietary intervention. My holistic doctor was like, if you have estrogen dominance and inflammation, that's what causes the fast growth. But if you can get rid of the inflammation, then um, the estrogen dominance is not going to cause them to grow rapidly. So
Okay.
with an anti-inflammatory diet, you can control inflammation in your body. So I was doing that. I was seeing an acupuncturist, and I was using steaming. So I was doing all the things. So I just kept getting better and feeling better, and so much was cleansing out of my womb as my periods were coming, and I stopped having. Oh, and the other thing is I had never been taught period care. Here I am in my 40s. And I didn't know how to care for my uterus. And so when I started steaming and when I started understanding, like, oh, there's actual things, like my favorite snack to eat during my periods was ice cream. Well, that's a terrible idea. It causes cramps and clots if you do that, right? So as
Yeah.
I started learning to take care of myself properly during my periods and tend to my body and steaming and doing all the things, I started to improve. Like I started being able to work again, and, you know, being able to function without, you know, so much pain and all the things. And I still have fibroids. I still haven't had the surgery, and I'm still steaming. So, but what I have now noticed is that my body has healed over time. Like I used to be cold, and I live in Texas, so it was weird. I was cold all the time. I was always the one wearing a jacket, you know, and long jeans, and, you know, like a little breeze would make me cold. Turns out like my circulation is bad. So as I continued steaming and as I started doing these things, my circulation improved. I started to sweat. Like, so it's been a process of healing. I'm not totally there, but my story shows that hysterectomy is not the only option, you know, and um, you don't actually, most of the time, fibroids are benign, right? So if they're not affecting your quality of life, you don't necessarily have to have a hysterectomy, but you do need to be able to function without pain and without hurting. So steaming was what enabled me to do that. I mean, obviously, I did a lot of other things too, a lot of changing my diet and doing things that were helpful. But the steaming itself started to address the old stagnation that was in my uterus. So I had a lot of stuff clean out during my periods, and I'm still having things clean out. But I used to have like almost completely brown menses. And I had been told that that was normal if that's what was always happening for me. And, you know, it was crazy because the first time I steamed, I used to have menses that were like 4 days of brown, maybe 1 day of red, and then 4 more days of brown. And, you know, and then it trickled off, you know. Um, the first time I steamed, I immediately got a red period for the first time, like right away. And I was like, wow, this is different, you know? And so there was a time also when I steamed, when the stuff cleaned out that looked like it could have been some sort of don't know. I don't want to get too graphic for people who are not into this, but I used to have 4 fibroids, and then afterwards I had 3 on the next ultrasound. So I feel like one of them was what cleared out through steaming, and just that's the steam getting it out. The others I still have. I had some shrinkage on some. So I'm still just working on it. But what I want to tell people is that if somebody tells you have to have a hysterectomy, I would definitely try steaming first.
Ooh, yeah.
Definitely. Definitely. Somebody ask a question in the chat.
Okay. Do you still steam every day up until your period, or what's your regimen now that you're feeling better?
Okay.
Yeah.
Okay, so yeah, I did steam every day for a certain period of time. And then it went down to like 3 or 4 days a week, or whenever when I felt like I needed it. And now I steam 3 times before my period, 3 times after my period, and once a week. So both those schedules combined.
Wow, that's still quite a bit of steaming. And I think what's one of the things that stands out to me here is that you're putting in a lot of work.
Mm-hmm. Yes. So this is the thing. I came to understand that healing requires work. You can outsource that work, go to a surgeon and have them cut out your uterus. They'll do some work for you. But what I did a lot of research when I was told that hysterectomy was my only option. I wanted to know, okay, well, what do people expect after hysterectomy? I interviewed all the people I knew who had had hysterectomies. I have several sister-in-laws who have had them. So I spoke to them. I had other friends. I searched the internet. I just got as much information as I could find out. And it turned out that in some cases, hysterectomy solved their primary concern because maybe they had excessive bleeding or maybe they had fibroids. And so taking that out solved it for a time. But then it could cause a cascade of interventions afterwards. Like some of them went straight into really heavy menopause, right? Some of them had vaginal dryness so bad they couldn't even walk. Like these different things that were happening as a result. Some of them had prolapse because there's 16 ligaments that hold the uterus in place, right? And so if you're talking about a organ that's sitting in the center of your body with ligaments that go through all your muscles, your abdominal muscles, and they come out your vaginal canal, they're just everywhere. Those get removed along with your uterus. And so then, like maybe it's 16 ligaments, maybe it's 14 ligaments. I don't know if it's 16 or 14. I don't want to say the wrong thing, but it's 14 to 16 ligaments that hold the uterus in place. And so like it's like if you remove the girding from a bridge, like everything's going to come down. So basically I came to understand that healing requires work, and you can do that work yourself. And I'm not saying that hysterectomy is not a great tool. I'm sure it saves lives in some instances, but I think it's overused and it's used as a Band-Aid in some cases, or like, to treat symptoms when they're not actually getting to the cause of the underlying root problem. In my case, the root problem was that my body isn't detoxifying. And so my body is trying to protect me by creating pockets, to hold all of this toxicity, most likely, and maybe that's in the fiber. I don't know. But what I'm saying is our bodies are wise. And if we can work with our bodies and instead of just circumventing what they're trying to do, then I feel like that's a much better model for care. Yeah.
Yeah, sometimes I hear people say, the fibroids didn't get there overnight. So when it comes time to, getting rid of the fibroids, you can expect that it's also going to take time to get rid of them. I have a question. So how are your periods now? compared
Oh,
to,
okay.
yeah.
So my periods are 2 to 3 days
Okay.
of fresh red blood. I take off for my periods. I schedule in advance and get 4 days off usually. I rest. I prep in advance. I make myself like hearty stews. Borscht is one of my favorites because it has beets
Ooh,
and beef
yeah.
and carrots, and so it's high in iron and all these different minerals that you need. And so I cook ahead of time and I put it all in jars, and so I can just warm it up and eat. But since I learned how to rest and eat warm things on my period, I don't have any pain. I do feel like I rest, I lay down a lot, because the uterus gets bigger when you're menstruating, and mine, because I have fibroids in mine, if you want to not have prolapse issues, you need to stay out of gravity when your uterus is heavy. So I try to lay down, but my periods have become like restful, meditative times where I like to paint and look over the month and plan ahead and, stuff like that. And they're not excessive as far as bleeding anymore. I alternate, between different herbal blends. Sometimes I'm using the hemostatic one, and other times, because it's so hot here in Texas, and because I'm starting to have the perimenopause thing, so I get like night sweats and things, I use the cooling blend, because it doesn't mess with the cycle length. Um, and the hemostatic one is like, there was a time where my cycle was trying to get shorter, and so I used the hemostatic blend to keep it at that 29 days. um, so yeah.
Is there any way, I mean, sorry, your cycles sound beautiful. That's really awesome what you do. Do you, is there any way that the fibroids are still impacting you?
Um, well, they're still there. And
Yeah.
I had to, and recently I've had a little, like, between 2020 when I was first diagnosed and now, I've had a little growth in some of them, not all of them, in some of them. And I'm trying to figure out what that there's an underlying condition there that I'm still trying to figure out. It's kind of tricky sometimes when you're doing something that's like, if you're a person who has a lot of toxicity in your body and you're detoxing, sometimes when you're detoxifying, things can get like, you'll have negative symptoms when your body is detoxifying. So
Yeah.
in my case, I think I I was I went to see uh the womb healer. I talked to you about her on the when I was doing the course, right? She is actually not she's called a womb chiropractor. So basically what she does is make sure that the womb is in the optimal position. And I went to see her. She lives pretty close to where I live. And she just using her hands, it was actually amazing. Um, is it okay if we go off on this tangent a little bit?
Sure, let's go.
Okay. So she's a folk practitioner. Her family is all midwives and these womb healers. And I told her one thing. I told her that I had fibroids. That's the only thing I told her. And so she's feeling around on my stomach and she's like, your uterus is fallen over. Did you know that? And I'm like, yes, I did actually, because the ultrasound showed that my uterus is anteverted. And she's like, oh, okay, well, it's just letting you know. But I hadn't told her that. She felt it. And then she asked me any, if I had mucus in my menses. And I was like, yes, actually, I do. How did you know? And she's like, well, because I can feel in your uterus. And so she does these massages and it breaks up a lot of stuff. And when you break up a lot of stuff that's like um I think like old residue and stuff, it releases and I, you know, she broke it up not just in my uterus, but like in my lymph nodes. And I think releasing that into my bloodstream is now now I'm trying to get it out of my body, but like I think it caused my fibroids to grow a little bit. I don't know if that makes sense. Like when you're getting something out and it gets into your bloodstream, then then it causes an inflammatory response, which causes the fibroids to grow, you know, but it's breaking things up. I don't know if that makes sense. And I don't know. That's a hypothesis. I don't know if that's the case. But what I do know is that like when when I get my menstrual cycle, a lot of mucus clears out. So I'm thinking that they're still breaking down. And, you know, according to traditional Chinese medicine, fibroids are congealed phlegm. So we know from Kelly's experiment that hardened things can be softened by steam. So I feel like the mucus that's cleaning out in my menstrual cycle is probably still the fibroids breaking down. But like you said, these have been in growing process for a long time. We don't know how long. And so it could be that they take a while to, you know, reverse the process. So
Yeah. Also, are you sure that the I mean, and this is, you know, again, not to blame, you know, elsewhere, but are you sure that the ultrasound measurements are correct?
I'm not actually. The holistic doctor I saw said we needed to do an MRI because he said, okay, so the first time when in 2020, when I was diagnosed with fibroids, they said I had a fibroid on my ovary. Then turns out I had an MRI at that time, and when we got the MRI back, it showed, because the imaging is better, so you can see more 3D. So you could see that it wasn't actually a fibroid on my ovary. It was a pedunculated fibroid, which is a fibroid that grows on a stalk. So it looks like, so it was behind my ovary, and so they thought it was on my ovary and not, but it turns out it's not. It was a pedunculated fibroid. So what I'm saying is that some of these things, it's hard to tell with the imaging. I don't like, I went to get another MRI. So I need to go pick up the imaging results to see what is going on, like if there's a difference from this one to the last one. But yeah, ultrasound technology, it's hard to really tell. Somebody asked a question. What was it?
They're asking about the ligaments. Oh, where is the womb chiropractor located?
Oh, she is in a town close by here to New Braunfels called Seguin.
Okay. Yeah.
And people go see her when I was referred to her by my friend Yolanda, who had a prolapse after the birth of her kids. And so she helped put her uterus back where it goes. So I go see her, and she lifts my uterus up, and then I wrap it and try to keep it in that position, you know.
Okay. So you found an amazing womb healer, which is amazing. I always tell people, find womb healers, you know, find like the traditional healers around you. And you did, you know, you're putting in the work, you're doing, you're making sure to have a good uterine cleanse. You make sure to rest your uterus when you have your cycle, not pulling it down, not, you know, and you rest. So you had 4 fibroids. They went down to 3.
Yeah.
A couple of them may be bigger.
Yes.
Or at least that's what you heard the last time you did the imaging. But are the fibroids impacting your life at all? You know, at first you mentioned you were having trouble, you know, even just doing normal things like cooking dinner. You were feeling prolapse and pushing down. You had a lot of pain during your periods, and you had heavy bleeding, is what I remember from what you were saying.
Yes. None of those things are an issue anymore.
Okay.
None of those things are an issue.
So you probably, okay, so you did really good research looking at what other people who had gone through hysterectomies had experienced. And you also found out that the fibroids might still continue to grow even if you do a hysterectomy or a partial hysterectomy. It sounds like they were recommending. So what do you think was the thing, had they told you that the fibroids wouldn't grow back, do you think that you would have wanted to do the hysterectomy just to get out of all of this pain or all of this trouble?
I mean, I probably would have tried something else first
Okay,
because
so
to
you're
me,
averse to cutting. You're like, keep my organ. Okay.
yes. Well,
Okay.
and also it just seemed really drastic to me. Like if a man walked in here with a problem with his reproductive organs, would you ask him if he was done having kids?
Listen, I say it all the
Because
time. If I went to another planet, let's just imagine. Okay? Like anything's possible. Even if we were looking at a sci-fi film, okay, whatever. And I arrived at another planet and I saw that they were removing the female reproductive organs out of a large percentage of the population. It would be so weird, wouldn't it? Like it's weird.
it is weird.
It's not. I know we live in a time where it's common,
Yeah.
but it's kind of a strange approach. Like
Right.
when you look at like the history of gynecology, pre-modern gynecology, which is everything that women have done for our health before surgery started, which, this type of gynecology, modern gynecology started in the 1800s. So when you look at everything prior to that, like cutting out the organs was never a part of the treatment. The only time the organs were cut was if the mom had died in order to cut out the baby to try to save the baby's life during childbirth. That's the only time that there was ever a surgery performed or cutting performed. So but now it's become commonplace. This is part of modern gynecology, and I think, with that, usually the response is, well, with modern medicine, we're able to save so many women's lives. And that's actually true. Hysterectomies do save women's lives. For example, somebody finds that they have cancer and it's spreading and it's stage 4, do a hysterectomy, get all that cancer out, get the sick organ out of the body. And, you could have really great, you could save that woman's life, right? Like this is a situation where I'm completely in favor of hysterectomies.
Right. Yeah.
But come to, like a situation where somebody is having period pain, what we found is that, according to my observations, what I see with case studies is that fibroids and period pain do not have to correlate, right? You had fibroids and period pain. Now you have fibroids and no period pain.
Right.
Right? To me, what I notice is the thing that pushes people to do the hysterectomy is that they have no other solutions, they're not aware of other solutions, and they want to get out of pain.
Yeah.
And pain is a mother.
Yeah.
Pain is hard. Chronic pain, people will do anything to get out of chronic pain, right? Agreed. I mean, whether it's self-diagnosing or self-medicating or whatever it is. I mean, people go to great lengths to get out of pain. Chronic pain is a mother, you know what I mean? Like, and so I understand that I can understand how that would be a driving motivator to get out of the pain, especially also when you're consulting a professional, a medical professional, an authority who says that this is the only option. This is the only way to get out of pain. The ibuprofen isn't working, so this is the next option, right? Or the ibuprofen is causing liver damage, so you can't take it anymore, so now your next option is this, right? Like it's a trip. So I understand why people choose to have the hysterectomies, but there's something there, which is that between the person having pain and going to a medical provider, I think that they should be given other options instead of the surgery as the only option. right? And so a lot of people say, oh, okay, well, there's myomectomies now. And a lot of doctors aren't trained how to do myomectomies. Myomectomies are surgeries where they do not take the entire uterus. They cut open, I mean, still an abdominal, full abdominal surgery where they go in, they remove the fibroids and close everything back up and leave the uterus intact. Of course, with a huge incision in it. And people who do myomectomies will not be able to do vaginal birth because of the risk of rupture. So I think a lot of times when people are looking at like the fibroid, crisis, they're like, okay, well, the solution is that more doctors need to be trained to do myomectomies and not only offer hysterectomy as the option. And it's something, but according to, I bought a bunch of gynecology books because I was just interested in what's in them, And according to the gynecology book itself, the Oxford, this one from Oxford, it says that over 50% of patients who undergo a myomectomy will have fibroids grow back at the 1 year checkup, by the 1 year checkup, meaning that's only 1 year that those fibroids are gone, right?
Yeah,
and
that happened to my friend.
And think about how long it takes a full open abdominal surgery. How long does the recovery from that take? When does somebody start feeling normal again, or like they can go back to their activities? I know they send them back very soon, but it's like, when does the person feel good again, right? So you gotta think, like, it's already, so you're doing a myomectomy for what, 7 months, 6 months, before they start now growing back, like maybe 3 months where you feel okay, again, and go back to your normal exercise and all your activities. Or let's even say 11 months. Let's say a myomectomy really only takes 1 month to recover from. Then, okay, so now you've got 11 months of your life. And then if the fibroids grow back at the 1 year checkup, the doctor, according to the gynecology book, this isn't, this is just, I wanted to know it was in the books themselves, then a hysterectomy is recommended at that time.
Right. I actually forgot to tell you a part. I considered getting a myomectomy because they were growing so fast, and I was like, I don't know what to do. This was before I started with the holistic doctor. It was between the first doctor, the gynecologist who told me I needed a hysterectomy, and the holistic doctor. And I don't know why I forgot about this, probably because, there was so much going on during the pandemic, but it was during pandemic times. And I looked into getting a myomectomy, but I also found the same thing that you said, that if you get a myomectomy, they come back. And I had my friend who told me about the womb healers, she got a myomectomy and her fibroids, and they came back, within like 8 months. She didn't even get a full year. So,
yeah.
Yeah.
I was just trying to be gracious to say, that maybe best case scenario, somebody could have 11.
Exactly. So I was like, that doesn't sound like a great option. Like, you're going to be out the money for the surgery, plus the recovery time, plus it's not going to fix your problem. So you're better off like finding out what the underlying issue is. And that could be different for everybody. For me, it's not knowing that I had this genetic MTHFR since I was a baby. I didn't find out until this fibroid journey. Like, that's when I found out. And that's when I started eating the right things and taking glutathione, which my body doesn't produce. That's the main detoxifier of the body. Like, you can't make glutathione, your body can't detox. So, I mean, it makes perfect sense when you think about it. And that is most likely the underlying root condition. And, the buildup over so many years of not knowing that I needed to be taking glutathione. I'm taking it now, and like you say, I still have fibroids, but I'm not fatigued to the point that I can't function. Because of steaming, I have less periods, no pain, and also resting. And also, I don't feel like my organs are going to fall out at the end of the day. And theoretically, according to the ultrasound, my fibroids are bigger. So why am I not feeling that feeling that I felt before? And I think I only can say that it's the steaming and changing like dietary habits and taking care of my body in the way that it needs. it's healing slowly, but generally anything that works takes time. You know, you want to lose weight the right way, you have to change your diet and take good care of yourself. You could go get those liposuctions or whatever, but you know, that's not going to fix, you know, whatever, you know, permanently fix whatever's going on with you. You know, there's a reason your body's doing what it's doing. And so many times I think in modern medicine, we are fighting against our own bodies, you know, instead of trying to find out why is it doing what it's doing, you know, which is the question I wanted answered by my doctor. And I never got an answer until I started seeing the holistic doctor. And the holistic doctor that I was seeing is also a trained OBGYN. And he switched from his OBGYN practice because he was doing hysterectomies and was like, there has to be a better way. Why are we cutting out women's uteruses because we can't stop the bleeding? So he switched to a holistic practice. And he works with women, primarily women with fibroids, and helps get them shrunk down. So it was working with him. He was the one who found, you know, he did a blood panel and tested my hormones and all the things, and then found out about the MTHFR. What I wish that more people knew was, like, if you get fibroids, you need to like check your blood and find out what's going on, to see if you're like, you have the MTHFR, what's going on with your hormones, what's going on. There's blood tests that you can do that test different levels in your blood of different growth factors. And those may be contributing to what's growing in your body. And if you can find out what is driving that, then that way you can stop what's happening, as opposed to just cutting out the organ, you know, which I fully think that the uterus is the hub for women. Like, it's the thing that, you know, it's not just for reproduction, it's for our hormones, it's for our vitality. You know, it does, I feel like it does so much. I think it was Tammy Lynn Kent who said that it's the hub of the wheel. And if you pull that out, then you're pulling the hub out of the wheel, you know, and that's why women have so many problems. Actually, I can trace my history back to a surgery that I had. After my second child was born, I had a tubal ligation. And 6 months after that tubal ligation, I had my first UTI. And then they just kept coming, and they just kept coming, and they just kept coming. And they got closer and closer together. They started, a couple of them turned into kidney infections. And that's when I was like, okay, we need to figure this out. I can't stay on antibiotics, and it's affecting my kidneys now. And that's when, you know, through trying to find out what was going on with my bladder, like, why am I getting UTIs over and over? That's when I found out that there was something pushing on the outside on my bladder, and we found out about the fibroids. But if I trace it all the way back, that surgery, the tubal ligation, was the beginning. So I honestly, when she told me I needed a hysterectomy, like, I was in a lot of pain, but there was a part of me that was like, no, I feel like, and this is me personally, I'm not saying this is for everybody, but for me personally, I felt like that first tubal ligation led to issues with my reproductive organs that started me on the path of either forming or accelerating the process of fibroids. I might have had fibroids for a long time, and they may have been small and not, you know, that big a deal, but something happened that accelerated that process, you know.
Yeah, and I mean, I don't think that, I think that what we can say for sure is that it's an unknown.
Yes.
What is the impact of tubal ligation? Tying off the fallopian tubes, how does that impact? You're interrupting the hormone development from the ovaries, and then the hormone, you know, the communication to the uterine cavity. How does that impact? I don't think we know. I do know that 1 in 3 women has fibroids. And then they say it's unknown why they develop. Do you know what I mean? Like, and so that's really interesting that you can just really point back to, you know, something really went awry, you know, after this, right? Like, okay, so I did pull up. So okay, so there's nothing that's really disrupting your fibroids are not disrupting your quality of life. You've done a lot of investigation and a lot of work to find alternatives that have helped you. Steaming has been one of the MVPs, one of the most valuable players in your regimen, as well as period care. in getting to a place where you have comfortable periods that are not painful and not heavy anymore. And so I just want to ask, there's nothing that's making you consider to have a hysterectomy right now? Or is it
No,
still?
not right now. I mean, I'm at the stage where like if I can control the growth and keep it from continuing to accelerate, then I don't see any reason to pursue a surgery. Um,
Gotcha.
if if my fibroids continue, grow too much, and then I have to, and my abdomen is getting distended and all that stuff, then sure, I'll have to consider it. But for me, um, I much prefer to see if I can treat the underlying cause, which, in my opinion, and I'm not a doctor, but I feel like the toxicity issue that I've had since I was little and didn't know, is the driving factor. Like I was telling you, I used to be cold all the time before I started steaming and going to the acupuncturist and doing abdomen massage and breast massage and all the things that I do, the dry skin brushing. Now I'm hardly ever cold. Like if it's cold, I get cold. I'm starting to sweat, which I never did before. So to me, these are signs that my body is healing. I also like my periods are much more healthy than they were. They're I'm still like every period, I'm still clearing things out. So as long as things are clearing, I feel like that's a positive. That's I'm removing stagnation and old residue that's probably been in there like all my life, and which is okay. So if you think I started steaming on Labor Day, which is September 2nd, 2019, and here we are in 2023. I I have like better periods, but I still have brown, which means like it's still clearing out. It's still, so I feel like, look, as long as I can do this,
Yeah.
and if you think about it, in 2020, I was told I needed a hysterectomy. And here we are in 2023. So like, I'm not going to promise that it's never going to happen. I'm not going to
Right.
say that it's not a good thing that's available. But for
Right.
me, if I can do anything else, I will definitely do that.
I love your story. Thank you so much for sharing it with people. And one of the things that I mean, I love hearing your story because you didn't want to do a hysterectomy, and so far, for the past 3 years, you've been able to avoid doing it, and not just avoid doing it. You were able to remove the factors that were disrupting your quality of life.
Yes.
But the reason why I wanted to have this talk was because of all of the people who have surgeries, who have hysterectomies, and then tell me, oh my gosh, I wish that I would have heard about steaming before I did the hysterectomy. People will tell me, again, we have no way of knowing this scientifically, but like how you said, you knew you really feel like that surgery, that initial operation that you did is what caused things to go, off, turn left, or go awry. So many people, I've heard people say, I 100% would not have had the hysterectomy. I regret it. I didn't know that I had any other options. And I would have never taken out, my uterus. Had I known about this, I would have tried it first. Right. And so that's why I wanted to have a talk that just very openly is like, hey, everybody, I'm Steamy Chick, Kelly Garza, and I actually believe that steaming can prevent hysterectomies. Maybe not in every case, but I think that it could probably prevent a lot of hysterectomies. And I don't just mean preventing an emergency situation where it's necessary. I mean preventing elective hysterectomies. Elective. You make the choice for that to be your treatment pattern. And so I did look up a couple of the statistics. So hysterectomies are the second most performed surgery after cesarean. So, wow, we're really cutting women up, aren't we? Cesareans and hysterectomies, the most performed surgeries in the world. There are 600,000 hysterectomies performed every year in the United States, and there are 20 million that have already been performed. So 20 million women in the US have undergone hysterectomies. I looked up the population of women in the US. The female population is 168 million. So that's about 8% of the population.
Wow.
So 8 in every 100 women in the US has had a hysterectomy. And that's roughly 2,000 hysterectomies that are being performed every day. And this is just in the US. So those are the statistics. I also want to call out, here we were talking with Liz, who had fibroids as the main concern that was causing the hysterectomy recommendation. But I have seen other people. In fact, yesterday there was we had a talk, a peristeam hydrotherapist panel. Peristeam hydrotherapists are highly trained steam therapists who work with steaming as the main method of treatment in order to address advanced women's health concerns. And one of them herself said that she came to steaming because she had endometriosis, really bad pain because of it, and was given the recommendation of a hysterectomy. She was able to steam and within a matter of months get to pain-free periods. Once she was able to get to pain-free periods, she never considered a hysterectomy again. And so she said actually the endometriosis is completely cleared as well. So really incredible. Again, these are the kinds of things that, because again, I'm steamy chick. I'm talking about steaming all day, every day. And I hear these stories, and so again, I was just thinking, wow, endometriosis, this is one of the cases where women do hysterectomies. I remember having a client who was in her 20s. She was in her lower 20s, not even upper 20s. She had endometriosis so bad that she was considering doing a hysterectomy because she was just in so much pain, and she had just could not handle the pain anymore. And the painkillers weren't working, as they don't with endometriosis in particular. And so she was considering taking, not having, doing a hysterectomy and giving up her ability to bear children, which wasn't something she wanted to do. And, again, within 1 month, she had such a severe difference in the amount of pain that she was experiencing that she was like, okay, I believe now, this is amazing. And so then she continued, and she was able to get a lot more comfortable. She had a really active lifestyle. And so then she was like, when she even just got a little bit more comfortable, she wasn't really doing that much steaming. She wasn't that dedicated to it. So then a year later, I saw her again, and she's like, okay, I've just been traveling too much. I'm going to start steaming again. And so she was able to use it for management. But that was now her go-to, rather than, oh my gosh, I need to do a hysterectomy and not ever be a mother.
Right.
So she comes steaming, right? Which is also so millennial, it's so 20-year-old, you know what I mean? To not really follow through and then be like, oh, I feel a little better. And then she comes back, and I'm just so glad.
You also had fibroids, right? And they cleared out through steaming.
Yeah, I did. But I didn't have a disruptive fibroids like that.
No, okay.
Yeah. So fibroids, endometriosis, heavy bleeding. Heavy bleeding is something that causes people to get hysterectomies. If people cannot get their bleeding under control, the doctor may take the uterus, and the person will agree to it again because heavy bleeding is so disruptive to the life. That's a really tricky one. Steaming, for heavy bleeding, it's tricky. You have to really work with a steam therapist or somebody who can get that bleeding under control, because steaming, you cannot steam while heavy bleeding or while bleeding at all, right? So it's you got to get the bleeding to stop. Then the steaming, to get the stagnation out and learning the period care can prevent, the heavy periods and heavy bleeding from coming back. But you have to stop the bleeding initially. So heavy bleeding is one of the ones where I'm like, ooh, there are a lot of emergency hysterectomies that can get performed because of that. And that is one where you do see true emergency situations where, because somebody could hemorrhage. Ultimately, if somebody's hemorrhaging, hysterectomy is one of the solutions, to be able to save somebody's life, right?
Right.
We have uterine cancer. This can be one of the one where, again, an emergency hysterectomy is needed. But with the heavy bleeding, if there's, if that pattern starts, I would love to see people start working with the steaming, because the steaming can hopefully prevent and reduce the amount of bleeding, just like it did in your case,
Yeah.
And then there's people who are in so much pain and cannot take pain meds anymore. The pain meds are causing liver damage or some problem like that. And so they choose to then do a hysterectomy, because if the pain meds don't work, then hysterectomy is actually the next option for pain management, which is that's one that I really feel like is, it's a loss. I think there's a loss in that being, the next measure after pain meds, and
Because
then
how much pain are they in to recover from the hysterectomy?
I know.
I mean, it's like you're giving them pain relief that's supposed to last their whole lives, right? But then there's so much pain that they have to go through to heal from the hysterectomy. And then what if they have a prolapse, and that can cause pain too.
Yeah.
So it's not like it's a foolproof measure that will protect them from pain in the future.
Yeah. So anyway, so those are some of them. We actually have come to the end of the talk, Liz. Thank you so much. This was so great. Again, I love your story. I love that you're willing to share it with others. And I mean, ultimately, I love the results that you've been able to get, and that you're out here spreading the good word. On Instagram, please let people know where they can find you. I know there are people who are going to want to follow up and learn more about, some of the things that you're doing to help with your fibroid management. You can find Liz, who is now a certified STEAM facilitator as well, on Instagram at perfect.nb, correct?
Mm-hmm. Yes.
NB stand for?
New Braunfels. That's where I live. It's in a little town in Texas.
Okay, I got you. So perfect.nb. You guys can follow up and ask Liz questions directly if you want to know more about, you definitely were talking about a lot of very interesting things when it comes to your approach to fibroids. Oh my gosh. Okay, so Liz, we are actually going to, I'm going into another panel, which is a doula panel. And you are invited to stay on for this panel if you would like to, or I can also let go of you if you need to go. I will unpin you from the top.
Okay. I'll stay, but I'll just be a participant.
A participant. Thank you so much. I really appreciate it. Woo! All right, you guys. So we are going to start a meeting for doula STEAM providers. Now, hold on one second. I'm going to stop the recording and start it again, so that way I have two different files.